Are you thinking about ways to keep your mind sharp as you get older? Many of us are. It's a common concern, and finding simple, effective ways to support our brain health is incredibly important. What if something as easy as a daily multivitamin could help? Maintaining cognitive function is key to enjoying our later years fully. It affects our independence, our ability to learn new things, and our connection with loved ones. Sadly, cognitive decline and conditions like Alzheimer's affect millions worldwide. This makes the search for ways to protect our brain health a top priority. People are looking for safe, affordable, and accessible options. Dietary supplements are often discussed as potential helpers in this area. Our brains need a steady supply of vitamins, minerals, and other nutrients to work properly. Think of them as the building blocks and fuel for healthy brain function. If we don't get enough of these essential nutrients, it could potentially increase the risk of cognitive decline over time. Past research looking at individual nutrients for brain health has had mixed results. It's been hard to get a clear picture. This is why larger, well-designed studies are so valuable. For a while, there was interest in compounds called flavonols. These are found in foods like unprocessed cocoa. Some earlier studies, often observational ones, suggested that flavonols might be good for the brain. Observational studies can show connections, but they don't prove cause and effect. We needed more rigorous clinical trials to really see if cocoa flavonols could make a difference in cognitive function for older adults. What about a simple multivitamin? Could taking a combination of vitamins and minerals daily have a positive effect on the aging brain? While some shorter studies had looked at this, there wasn't much long-term research specifically focused on older adults. A longer trial had included older male physicians, but a broader study was needed. Researchers wanted to understand if a daily multivitamin could benefit a wider group of older men and women. To address these questions, a significant research project was launched. It was funded by the NIH and led by Drs. Laura Baker and Mark Espeland at Wake Forest University School of Medicine. They designed a large clinical trial. The study involved over 2,200 participants. All were aged 65 or older when they joined the study. The average age of the participants was 73, representing the target age group for cognitive health concerns. Participants enrolled in the study between 2016 and 2017. They were randomly assigned to different groups. For 3 years, they took a daily supplement. Some received a cocoa extract supplement. Others received a multivitamin mineral supplement. A crucial group received an inactive placebo pill for comparison. This helps researchers see if any effects are due to the supplement itself. To track cognitive health, participants completed a series of tests. These tests were administered over the phone at the beginning of the study. They were then repeated once every year for the 3-year duration. The researchers looked at several aspects of cognition. They measured global cognition, which is an overall assessment. They also specifically tested memory and executive function, which includes skills like attention, planning, and organization. After 3 years, the researchers analyzed the results. They first looked at the group taking the cocoa extract. The findings here were clear. There was no significant difference in global cognition scores between those who took the cocoa extract and those who did not. Cocoa extract did not show a benefit for overall cognitive function in this study. However, the results for the multivitamin group were quite different and very encouraging. Participants who took the daily multivitamin had higher global cognition scores compared to those who took the placebo. This was a significant finding. The positive effect of the multivitamin was even more noticeable in a specific group. Participants with a history of cardiovascular disease seem to benefit the most from taking the multivitamin daily. The positive effects of the multivitamin weren't limited to just global cognition. The study also found significant improvements in other key areas. Daily multivitamin use was associated with better scores on tests of memory. Improvements were also seen in executive function. This means skills like focusing attention, planning tasks, and organizing thoughts showed positive changes in the multivitamin group. Cocoa extract did not show these benefits. These findings are very promising. They suggest that taking a safe and affordable daily multivitamin mineral supplement could potentially help improve cognitive function in older adults. It might offer a way to help protect cognitive health as we age. The fact that it's a multivitamin, something widely available and generally considered safe, makes these results particularly exciting. It's a simple intervention that could have meaningful benefits. While the results are hopeful, the researchers emphasize that they are still preliminary. This is an important first step, but more research is needed to confirm these findings. It's too early to make a universal recommendation for everyone. Dr. Baker noted that additional studies are needed in larger and more diverse groups of people. Researchers also want to understand why the multivitamin might be beneficial for the brain. What specific nutrients are responsible for the effect? Despite the need for more research, this study represents a significant step forward. It provides strong evidence from a large, well-controlled clinical trial. It shifts the focus from individual nutrients to the potential benefit of a balanced multivitamin. For older adults concerned about cognitive health, these results offer a sense of hope. It suggests that a simple, accessible daily habit might contribute positively to maintaining brain function over time. This study gives us exciting information, but it's just one piece of the puzzle. If you're an older adult thinking about your cognitive health, this research is a great conversation starter. Talk to your doctor about these findings and whether a daily multivitamin might be appropriate for you based on your individual health needs and diet. Stay informed about ongoing research. And remember that maintaining overall healthy habits, like staying active, eating a balanced diet, and engaging socially, are also crucial for supporting your brain as you age.